You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, we're talking about breast cancer prevention. With us, we have an expert on the topic. She's a board-certified general surgeon, board-certified plastic surgeon who has dedicated her life to helping women both with early detection breast cancer and to create a lot more public awareness on different treatment options. With us, we have author of Waking the Warrior Goddess, Dr. Christine Horner. Dr. Horner, welcome to the program.
Thank you. It's my pleasure to be
Good.
here.
Now, did I get that intro right, by the way?
Well, you sort of did.
Okay. Tell me.
Well, you know, I really have a voice about prevention.
Okay.
So as a plastic surgeon, I was on the cleanup crew doing lots of breast reconstructions. So when I discovered all the things that are really associated with developing breast cancer and all the things that we can do to protect against it, and they're all natural, that became my message. So I left my practice so that I could teach people how to prevent this disease in the first place. You believe it's preventable? Absolutely. I think at least 95% of the cases are preventable.
Now, something about you that I think people should know, that I guess not too long ago, breast reconstruction after cancer, mastectomy or whatever, wasn't covered by insurance. And you spearheaded a program to get it covered. I guess you met with President Clinton, and I guess you should tell the story here.
Sure. Well, you know, the incredible story is that in 1993, insurance companies, they used to pay for breast reconstruction, and all of a sudden they decided they were not going to do that. And so I got a letter from an insurance company that said, we're not going to pay for breast reconstruction on your 32-year-old patient because it's on an organ with no function.
Interesting.
I went,
Okay.
I think you're going to pay, and everyone is. So I just got really mad, and I just thought, you know, this is criminal. So I worked on organizing a national campaign to pass legislation to make it mandatory that insurance companies pay for breast reconstruction. So that went through in 1998. So now it's a federal law that insurance companies must pay for breast reconstruction following mastectomy.
Okay, good, good, good. Now, for people that are just tuning in, you know, we're talking about breast cancer prevention, neglected, I guess, things that people don't know about that can help in prevention, but also for people that have breast cancer. But I also want people to know that I've done at least 2 other interviews with you that can be found on our website to talk about some of the other things, what they need to know about thermography, early detection, things like that, and imaging. So let's start with what you brought for us.
Sure. So, you know, what I found when I first went through the medical research is that the thing that influences our risk of developing not only breast cancer, but really any kind of disease are the foods we put into our mouth, basically our diet, our lifestyle, key nutritional supplements.
Okay.
And you can basically, as I said, I think that about 95% of breast cancers are completely avoidable by paying attention to the things that you need to avoid and the things that you need to favor. Now, as a medical student and in residency forever, not one course in nutrition, thousands of studies. But so right here is kale. We hear so much about kale now because it's so nutritious, but it's actually a cruciferous vegetable. Broccoli is another in that particular family, and each cruciferous vegetable has several different chemicals in them, and they all have incredible anti-cancer properties to them. So very important. Even the United States government has said we should all be eating cruciferous vegetables on a regular basis because it lowers the risk of breast cancer, prostate cancer, heart disease,
and there's studies
and so
to back
forth.
that up, by the way.
There are thousands of studies to back this up. And speaking of thousands of studies, here's an Indian spice called turmeric. 5,500 studies in the medical research, and lots of studies done here in the United States, as well as MD Anderson, the big cancer hospital, showing it's the #1 anti-cancer spice, inhibits the growth of 17 different kinds of cancers. And they even design chemotherapeutic drugs off of some of the mechanisms in which turmeric works.
It's hard for cancer to stick around when they have these type of things in the system?
It has dozens of different ways in which it inhibits the growth of cancers, from directly killing tumors to preventing them from invading to surrounding tissues, and, you know, just many, many ingenious.
Turmeric, right?
Turmeric,
right. So do you this turmeric, do you take it with a pill? Do you like it with a spice like that?
Well, you can do both. So, you know, in India, they have one of the lowest incidences of breast cancer in the world, and one of the reasons because they cook with it. So the idea is that you cook with about 1/3 to 1/2 of a teaspoon of turmeric per serving at the end of cooking, so it should be heated a little bit, but not too much.
Okay.
Obviously, this is tough for most Americans to do, right? So that actually is a place where we want to look at taking some nutritional supplements, and turmeric is one.
So, okay, so with turmeric, if somebody is, and I have a close friend that I grew up with, breast cancer, double mastectomy, she's really afraid. Her doctor said, be careful doing these things.
Okay. The doctor,
and she's in remission. She's
the doctor doesn't read the medical research.
But is that being said to a lot of people, by the way?
I'm saying it.
But aren't they afraid because they're worried to do anything? So
they are, and in my estimation, I get very kind of direct with this, where I think it's medical malpractice now, because in the medical research, as I said, 5,500 studies on there, even done at MD Anderson, showing that it is one of the most crucial things that we can do to help improve the survival statistics. It takes away side effects of chemotherapy and helps in prevention in the first place.
Okay, good. How many servings? Do you have a dosage that you recommend? With
yes, so
turmeric?
1/3 to ½ teaspoon at the end of cooking per serving. If you want to take it as a supplement, the therapeutic dose is at least 1,000 milligrams a day.
Okay, and does it is it okay with heat?
You have to heat a little bit, but not too much, according to Ayurveda. And I'm certified in Ayurveda, too.
Okay.
Yes, yeah.
Good.
And then in the realm of foods, so here are broccoli sprouts. So broccoli sprouts are really interesting because we know that broccoli is good for us, but the sprouts actually have 100 times more of a particular anti-cancer chemical called sulforaphane in it, which is why, you know, they're excellent to eat the sprouts. And then the other food that I brought is flax seeds. And flax seeds are considered the most important food for you to take when you have breast cancer to prevent it. It's the only food that interrupts every single step of the estrogen pathway throughout the body. The world's leading researcher, Lillian Thompson, who lives in Toronto and works at the University of Toronto, has done hundreds of studies on flax seeds. And we actually found that what happens if you give them to breast cancer patients when they're first diagnosed, their tumors will shrink. And
so
in
it's
fact,
like an anti-estrogen?
It works 12 different ways. Again, so there's
Okay.
lignans in it that have 12 different anti-cancer properties. They're also high in omega-3 fatty acids, which are the healthiest types of fats that we can consume with multiple anti-cancer properties.
Very nice.
So you got to grind these up in a coffee grinder, as fine powder as you
Okay.
can, and you can add it to anything, to your vegetable dishes or so forth. There's a terrible statistic, which is that 90% of people in the United States who have had a heart attack go back to their normal diet, you know, pre-heart attack.
Okay.
It's that hard for people to do that. So this is where it's actually good to take some nutritional supplements, and you know, there's lots of things that you actually can't get enough medicine without taking the supplements. So turmeric can be taken as a supplement. There's actually a lignin supplement, you know, for the flax seeds. Vitamin D, incredibly important. There's been an explosion of research on it showing that it's low in most disease states, and if you get the vitamin D levels up, it drastically lowers the risk, in fact, cuts the risk in half of breast, prostate, and colon cancer, and also helps with survival. And then finally, AHCC, which is a mushroom formula, and this is from Japan. It's just a generic ingredient.
AHCC. I want to put that at the bottom of the
AHCC.
screen.
Yeah.
Okay, good.
And so this is actually prescribed in hospitals in Japan because it helps with the survival statistics with cancer patients.
What's the mechanism?
So it's made from a variety of different medicinal mushrooms, and what they found that it does is it supports every single cell type in the immune system. So our immune system is what keeps us well, and our immune system gets slugged with stress, poor sleep, toxins. Sugar really slugs the immune system, and one cheat way that you can help to keep your immune system strong is to take AHCC. People who are taken on a regular basis have a much lower incidence of all sorts of different kinds of cancers and viral, you know, conditions and so forth, and as I said, improve survival statistics.
And people that are watching this, so if they are in remission,
Yes.
even newly in remission,
Yes.
8 months, 4 months,
Yes.
or they've been diagnosed and they're scheduled for surgery of some sort, they can take this. It's safe.
Absolutely, and in fact,
And the experts agree with this? Who would argue with what you're just saying?
People who don't know.
With the radiation oncologist?
People who do not read the medical literature, because truly these things help with the effectiveness of chemotherapy and radiation, and take away the side effects.
Tell me this, by the way, because we're out of time, but
Sure.
that, you know, about nutrition. So even with taking these supplements,
Yes.
it's like people taking cinnamon for diabetes but eating
Correct.
terribly. So do you believe that you've got to eat pretty clean, like lean sources, good sources of protein, maybe some good vegetables?
Not maybe
Stay
good
away from the
vegetables,
sugars.
primarily good vegetables,
Get away
yes.
from gluten and dairy, things like that.
Yes.
And take these supplements.
Yes. Yes.
It doesn't work without the right nutrition.
Well, supplements have the word supplement for a reason. So you're supposed to have a healthy diet and lifestyle, but as I told you, that's hard for a lot of people.
Tell us what they should do, and we're out of time.
Okay, so you know, eating mostly a plant-based diet, getting plenty of exercise, even brisk walking can improve survival statistics twofold, and getting vitamin D so you can get the sunshine if you can, or taking the extra vitamin D, doing a stress-reducing technique on a daily basis, so like meditation, breathing exercises, and actually relationships. They found that the thing that affects our health more than anything else is feeling loved and supported.
If you're happy.
Feeling loved and supported, so nurture your relationships.
Okay, when you say plant-based, are you talking about vegetarian?
Well, primarily, I mean, the more plants you eat, the healthier you are.
But a little bit of meat. I mean, humans ate meat or fish.
Well, we could get into a philosophical argument
well,
here.
Philosophy aside, there's no tribe, nothing in history.
Well, that's okay. But
no
you know
humans have never been
one of the
vegetarians.
largest.
That's a fact.
No. One of the largest risk factors. No, it's not. One of the largest risk factors.
Tell me a society. We'll go longer that we're vegetarians. Society.
The Vedic society, which is an ancient society 5,000 years ago.
Okay.
And but you know what the research supports now is that meat. Rating red meat, particularly when it's...
What about fish?
Depends on the type of fish, because we have so many toxins. So right now in this day and age, eating the red meat conventionally grown in the United States, or eating toxic fish, it's one of the #1 risk factors for breast cancer, prostate cancer, and colon cancer. In fact,
what about grass-fed
400% increased risk. We don't have studies on that yet, because this is a relatively new thing that's going on, and you've got to follow people out for 20 years.
You're right. I mean, finding clean fish these days is very difficult.
It is.
Because they have heavy metals, and pesticides, and everything else.
PCBs, yeah.
So a little bit of maybe fish, the cleanest fish
like
possible.
wild-caught salmon, probably.
Okay. And then plant-based.
Yes, as much plants as you can get in.
And then supplement with this.
Exactly.
Well, good. I want to thank you for coming on the show.
Oh, you're
How do they find out
welcome.
more about you? What's the best way to get more information? You have your book, which is Waking the Warrior Goddess, right?
Yes.
And what's the best
My
way?
website. So my website is drchristinehorner.com. It's drchristinehorner.com.
All right. Thank you for coming on the show. Very
You're welcome.
interesting. And we're
My
going to have you
pleasure.
back to talk about some other topics.
Okay.
You've been watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.